welcome to the World Federations of Pediatric Intensive and Critical Care Societies World Pediatric Intensive Care Unit Awareness Week podcast series. I am Ririe Fachrina, one of the member organizing committee of World PICU Awareness Week and a member of Education Committee of WISPIC. This is the time of the year to recognize the incredible work done in pediatric intensive care unit around the world. This year, 2026, we are focusing on a crucial theme, take care of those who care. This goal is to highlight the importance of caregiver well-being as a fundamental pillar of safe, ethical, and sustainable pediatric critical care. Pediatric intensive care unit professional face intense emotional, ethical, and clinical demands every day. Supporting the people who provide this care is essential not only for their well-being but also for the quality and safety of care delivered to the children and their families. In this episode, we are focusing on the incredible work being done in Asia continent. As the representative of the Asia walking, we already have 4 great speakers who have dedicated their time to take care the critically ill children, and as the caregiver, they have lots of experience services in difficult circumstances. Because caregiver well-being is patient safety, sustaining the ICU services requires protecting those who deliver them. And I will introduce proudly our parents of PICU survivor, Mr. Mohamad Aris, Iqqhwan, the daddies, and Mrs. Amalina, mummies, of Mohamad Idris, infant with 2 months old now. And he has a bad history since delivery with respiratory distress at day 3 of life and found have multi-organ failure and bloodstream infections with acute myocarditis and acute heart failure with large congenital heart defect and pulmonary hypertension. He was intubated and ventilated for pulmonary hypertension crisis and got mechanical ventilation in severe condition with got inhaled nitric oxide and inotropic support, and fortunately, he has responded to all of the treatment well, and the organ failure recover with time. He was discharged home well with established enteral feeding after 3 weeks of hospitalization stay, and after twice review and monitoring in post-discharge clinic, he was feeding well, gained good weight with appropriate developmental development. I will ask 1 or 2 questions regarding your experience as the parent of the PICU survivor. As the parents and family caregivers, we do believe you often feel uncertainty when your child is hospitalized. Did you experience any anxiety while your child admitted in PICU? And how did you handle it? Do you have any experience psychological trauma or stress during your child treatment in PICU?
Okay, thank you, Mr. Riri. Miss Rili. Okay, of course, we feel significant anxiety during that time. There was constant worry about our child condition because seeing him surrounded by a lot of machine and not knowing what each day would be would bring. Whether his condition would improve was emotionally overwhelming. To handle this anxiety, we found it helpful to stay informed by communicating regularly with the doctor and nurse. Their explanation helped us better understand what happening and reduce of fear of the unknown. Because during this time, this is a fasting month or so, so we are moving every day. So we need to take care of another our son. So we also make effort to stay close to our child and to get involved in their care, even in small ways, as it gives us a sense of purpose and connection. We also lean on our support system, including family members and close friends who provide emotionally comfort during difficult moments. We learn the importance of take short break to rest and regain our strength, so we could continue to be there for our child. While the anxiety was unavoidable, having a clear communication, staying involved, and seeking support help us cope with the experience.
I think this looks like a scary experience if we didn't know what exactly happened in uh, our children, especially because he is looks like far away in the PICU and you are outside the PICU, did not know anything, something like that. And the other questions is to mom and dad. To promote caregivers' well-being, the proactive information sharing from the healthcare provider is one of recommended approach, which includes in-person communications and participation to take care your children. Do you agree with this approach, or do you feel it's much better if you are always uh, beside your child, not outside the PICU?
We strongly agree. In such situation, face-to-face conversation allow doctors and nurses to explain the child's condition clearly and provide timely update and respond to question with empathy and reassurance. So this kind of direct communication actually help reduce confusion and also build trust between the caregiver and also the medical team. And at the same time, involving the caregiver in taking care of their child is equally important too. Even small tasks such as comforting, because our child is very small. He's just a baby, so just comforting, and then or being present during care can give parents a sense of purpose and also control. This participation is not only support the well-being of caregiver, but also strengthen the bond between the parent and child itself during a very difficult time. So this somehow help caregiver cope better with emotional ups and downs of the PICU journey and build confidence in the care that our child is receiving.
In the other way, you mean we still maintain the connections and bond between your child.
Yes. Even though we cannot do anything, but being present can can make us feel a bit of reassurance and have a purpose, at least to keep going once at a time.
Yes, it's one of the role of the family patient center care. Yeah, it's a very beautiful insight from mom and dads because we need uh, and we know the bond and connections in between parents and child is a strong relations with the improvement of the treatment. I think if you have one or two message for all of the parents who have the same experience with both of you during your treatment of your child in the PICU can support the other parents.
Okay. Actually, when our child was admitted to the PICU, we quickly learned that recovery is not a straight path. There are ups and downs, and as long as our child remains in the PICU, we understand that he's not completely out of danger. So every small change in condition can feel significant, and even setback can feel overwhelming. So, as parents, this down moment can be deeply traumatic. So it's not about what we see, but it's about the fear of what could happen next. We understand that the uncertainty, the waiting, the decision can take a heavy toll on our heart and minds. But in the midst of this, one thing that is very important, which is the response of the medical team. So when doctors and nurses act quickly, confidently, and with purpose, it brings a sense of reassurance in the most frightening moment, and it reminds us that our child is in capable hands. So equally important is how they communicate with us. It's very clear, honest, and timely explanation that help us understand what is happening and why. Even when the news is difficult, being informed actually help reduce our fear of the unknown. And it also allow us to feel included in our child's care rather than feeling helpless on the sidelines. So what matter most is not only the treatment of our child receive, but also the trust that is built between the family and also the medical team. Because knowing that there is a dedicated team acting quickly and keeping us informed, it actually gives us strength to keep going, like I said earlier.
It's so wonderful insight and the beauty of togetherness through that uncertainty, situation and circumstances make strengthened. And yeah, I think it's positively improvement through recovery support our child conditions. Thank you for Mr. Aris and Mrs. Amalina for all of your experience and sharing with us. And we do hope all of the parents who has taken care their child or children during this difficult situation will be learning from your experience. Thank you again. We will continue to the one of our speaker is an accredited social worker who has experience as a medical social worker, Miss Lydia Tan. She working in the Kandang Kerbau Women's and Children Hospital, Singapore, hold qualifications from Singapore University of Society. She is a medical social worker with 5 years of experience supporting families in her care. She currently works in pediatric intensive care, where she journeys alongside parents of critically ill children as they navigate crisis, uncertainty, and emotional stress. Her work focuses on caring for caregivers, supporting the families through difficult moments, like we have heard from Mr. Aris and Mrs. Marin. Through this, Miss Lydia Tan has developed a deep appreciation for the value of life and the resilience in time of crisis. As a social medical hard worker, do you agree that caregiver has a central role of psychological support during hospitalization in PICU? And how is your strategy to approach the insight from family caregiver and build the good communication with them?
Hmm. Thank you for the introduction. Yes, I do believe that our caregivers play a very essential role like our parents sharing earlier on, and they are the core to our child's well-being and growth here. So as I think as what we have described, when a child is admitted, the family are suddenly thrown into a very unfamiliar environment and it's very high stress. And they're also trying to make sense of the complex medical information while also trying to manage their own shock, fear, uncertainty for their child's condition. So as a medical social worker, we act as a bridge between families and medical team during this time. Our roles involve providing emotional support, crisis intervention, helping family process what has happened, facilitating communication so they feel heard and understood. Right? We also connect them to practical resource and in the future community support. What I do notice over the years is that early support do make a huge difference. Because when I'm able to meet their families early, usually within 24 hours of the referral, they tend to adjust a bit better. They feel more grounded, more supported, confident to ask questions, and even advocate for their child. And I always like to mention this to the parents is that, you know your child the best. We know their habits more than us. And we really enjoy when parents share about their children's, little habits. And that's how our family medical team is able to provide better care for them. So that's how we encourage our parents to do more sharing with us as well. And sometimes beyond all the intervention, what really simply matters, right? It's just being present for them, sitting with them, listening, letting them know they're not going through this alone. And in Singapore, we are working with families from very diverse culture, social background, and culture sensitivity is really important. We have learned to pay attention to different families express distress. Some may be very vocal, asking many questions, while others may be quiet or more withdrawn. When I'm usually unsure about their cultural practices or preference, I try not to assume, and I'll definitely ask them respectfully. We also check for language preference to involve interpreter when needed, especially in this sensitive time to make sure all information, which is communication, is key. So in such situation, building rapport is really important. So we often use a framework that we call SWANA. It starts with stabilizing the situation, creating a calm environment, and addressing immediate needs, such as orientating the family to the environment, where maybe the visiting time, who can visit, when can we get food, shower, however, a place to rest, right? And we acknowledge what they are going through and validate that it is very significant. We focus on understanding through active listening and normalizing their reaction, helping them see that the feeling is a natural response to a very difficult situation. From there, we look at practical action to address their immediate concern. Maybe even is to just to reach out to the medical team to understand, hey, what is this machine about? What do the numbers even mean? That actually give them, like our parents earlier on shared, a lot of certainty, control, and know that they can be involved as well. So in practice, I also observe how the parents are coping, whether they are pacing, tearful, or very quiet, and respond accordingly. So sometimes simple statements like, I can see how frightening this must be, or you are doing everything you can for your child, can go a long way in helping families feel seen and supported.
So very amazing what you have done, Miss Lydia. And because we have a Asia cultural, with warm regards, and in our culture, it's always asked, how do you feel? Are you anxiety? Yeah, it's a regular approach from us, even in daily, without that circumstances, emergency situation. We still can smile and make the warm introductions and hug, a big hug. I think it's Asia culture. Might be it's different with other continent, but we're proud of this. I think almost every Asia country have warm greetings and a big hug and always smile and always ask, how do you feel? Are you comfort? Are you okay? I think it's one of the our best approach to reduce the anxiety as the psychological impact during the emergency situation in the ICU treatment of your child or the patient's children. And what is your program to provide counseling and crisis debrief if it's happened?
So we, on top of supporting our parents, yeah, we also support our healthcare workers. So it's also important to recognize our healthcare workers are also caregivers. So we have created a structured carer support program that focuses on providing counseling, peer support, and crisis debrief. So it actually have three components. Right? The first component actually is individual counseling, where staff can have confidential one-to-one with the medical social worker. This could be for difficult case, work stress, or even personal challenges affecting their well-being. We also run monthly support group for high-stress department like PICU or even at the neonatal ICU and NICU. This session provides a safe space for staff to pause, reflect, and process their experiences together. For particularly difficult events, we provide, lastly, a critical incident debrief where teams can come together to process what happened and support one another. We also conduct mutual care training to equip our staff with basic peer support so that they can better support one another in their day-to-day work. Ultimately, the goal is to remind our healthcare workers that they don't have to carry everything on their own as well.
I agree with you because the risk of burnout in the caregiver is often is a health system, so it's not individual approach. So the working together as a team, support each other is one of the leading to avoid burnout and to like counseling provide individually and all of the group, and it's one of the solution of the crisis debrief. Thank you, Miss Lydia, for all of your amazing work in as the caregiver, and you are taking how to make it a well-being, and we will continue. Please welcome Nurse Manpreet Kaur. She is a pediatric critical care nurse with 18 years of PICU experience and working in the PICU at the Advanced Pediatric Center, Postgraduate Institute of Medical Education and Research in Chandigarh, India. Nurse Manpreet Kaur holds a Bachelor of Science degree in nursing and fellowship in pediatric critical care nursing. For the past 15 years, she has been a certified advanced life support instructor, and for over 10 years, she was actively involved as a simulation instructor, training healthcare professional in emergency response and critical care skill. Her passion is to empower bedside nurses through education, simulation-based training, and evidence-based clinical practice to improve patient outcomes in pediatric critical care field. So, Nurse Manpreet Kaur, as a PICU nurse, what does caring for the caregivers mean to you?
Thank you, Dr. Ririe, for the question. To me, caring for caregivers means recognizing that the people who provide care, whether they are the nurses, doctors, or family members, they are also human beings with physical, emotional, and mental needs. It's about supporting them so that they can contribute to give safe, compassionate, and effective care without burning out. I can share with you a simple example. Like during a busy shift, PICU shift, a nurse is managing two critical patients and starts feeling overwhelmed. A colleague notices, and she just steps in to help with medications and documentation, while the senior nurse ensures that she gets a short break. That small, just a small act of sharing workload and giving support is caring for the caregivers. So this is just a small act. Now, this caring for caregivers is very, very essential because when we caregivers are cared for, patients will ultimately receive better care. And as caregivers, we are trained to be strong for our patients, for their families. But this strength does not mean we don't need to support. We also need support. And caring for the caregivers is, it's not just a luxury, but it's a necessity. It's very, very important because then only we can give our 100% to our patient care.
Thank you. It's a very good and great insight as a picture nurse because you are need a well-being is the human well-being, and because all of the caregivers must focusedly doing the medical proposing sometimes might be we are forget as the human well-being. So it's a great insight for you. Remind us about that. While caring for critically ill children in daily practice you are doing, how does the emotional stress will affect you, Miss Manpreet?
Ma'am, while caring for critically ill children, we the emotional stress also affects us because working in the PICU it's emotionally intense. We build connections with the children as well as their families and become part of their most vulnerable movements. So these are we can many times we can see that despite of doing everything right, the outcome is not what we hoped for, and that stays with us for a very long time. I can personally say that I had moments where after a long shift when I went home, but mentally I was still in PICU, replaying all the event, thinking about the child, the parents, and wondering if there was something more I could have done for the patient. So over time, this can lead to like a compassion fatigue, what we call, when you feel emotionally drained, but you still care. It can become harder to express it the same way. And during my experience with my experience, I have learned that acknowledging these feelings are equally very important. We can do that by talking to our colleagues, sharing our experiences, even taking a few quiet moments for ourselves only. It helps to process rather than carry everything inside us. Because ultimately, if we don't care of our emotional health, will eventually affect not just us but also the care we provide. It will ultimately affect the care. So, dealing with the emotional stress is equally very, very important for the caregivers.
I agree with you, Miss Manpreet. And we realize the human being aspect we emphasize is it means as a human being, we will feel sad, we feel disappointed, we feel anxiety too, as the, you know, doctor, nurses in the PICU, because we know all of the process, medical procedure will affect and it's success or not. So it will make us more anxiety might be than the parents. So that's the aspect of human well-being. We will face it more than I think we think bigger than the parent. So we realize as the caregiver inside the PICU, we face more stressful, more anxiety conditions. So we must taking care ourselves as individual, emphasize the empathy, but not fail that then. So it's a very deep psychological process in and maturing in every caregiver, especially medical caregiver who works in the PICU. I think it's a very complexity situations, but every uh, of us will learn from that situations, and we will thank you for Ms. Manpreet insight. Okay, thank you all for joining us for this episode from Asia continent.